Sexually transmitted infection syphilis is up 26% nationwide. And when it comes to Lake Charles, statistics show residents should be concerned. For example, there are more than 500 new cases of gonorrhea in this region alone. KPLC's Amma Siriboe has all you need to know.
Among Louisiana's 9 public health regions, Lake Charles ranks the best when it comes to the amount of people getting STDs. However, experts worry about the increase in numbers seen here.
Of course, if you want to protect yourself, the fewer sexual partners that you have, the less your risk is going to be.
Lacey Kavanaugh, Region 5 Medical Director, says although condoms are relatively a good form of protection, it is possible to still transmit some sexually transmitted infections or STIs, even with condom use.
For example, herpes. Herpes is one of the ones that can just be transmitted from skin-to-skin contact. So a condom would not be 100% effective at preventing it, for example.
As a preventative measure, Kavanaugh advises the following.
We usually recommend routine screening for people who might be engaging in high-risk activity, at least annually. Sometimes we recommend more than annually. In the case of a new partner or a known exposure.
This will help identify cases that may be asymptomatic. But when there are symptoms, things you could look for is a rash or discharge. However, it could get tricky.
Symptoms can be confused with other things, like, for example, a rash. Poison ivy can cause a rash. Contact dermatitis can cause a rash.
Kavanaugh says African Americans in the age group of 20 to 39 are disproportionately impacted by STIs. However, the key is to be mindful of your status to help bring the numbers down.
If you ever have symptoms, consult a healthcare provider and don't be afraid to talk about it.
Amma Siriboe, 7 News.
Kavanaugh says specifically for HIV and syphilis, men tend to be more impacted than women. And with gonorrhea and chlamydia, it's close to 50-50.